Hi, is Professor Dr. Erkan Yıldırım. I'm a thoracic and a lung transplant surgeon. This is our third video regarding COPD balloon treatment. And in this video, we are discussing about the period after the balloon treatment done. Post-treatment follow-up. Patients are discharged 2 days after the COPD balloon treatment and are advised to return for a checkup within 10 days or at most 2 weeks. During this initial control, their condition is re-evaluated through examinations and breathing tests with Ventolin. Patient compliance and recovery. We emphasize the importance of patients consistently using their medications, engaging in regular walks, maintaining a balanced diet, drinking sufficient water, and consuming plenty of protein. These factors are crucial as 80% of the healing process occurs within the first month. A strict treatment protocol is followed to suppress inflammation and edema in the bronchi, and adherence to this protocol is vital. First month assessment. If the patient is generally well after the first month, their medications are re-regulated, any deficiencies are addressed, and they are sent home. Recommended practices for patients. Patients are strongly advised to perform breathing exercises, drink at least 3 to 3.5 liters of water daily, more in summer, and walk as much as possible. Climbing stairs, even in short intervals, example 2 steps and rest, then 3 steps, is highly beneficial for strengthening the diaphragm and leg muscles and respiratory dynamics. Observed improvements. Within the first days, the first control, an increase of approximately 15 to 20% in lung capacity is observed. Within the first month, the increase ranges from 30 to 75%. Some patients even experience over 100% of improvement in the first month, with capacities exceeding 2 liters. Patient feedback. Patients often report feeling much better, no longer needing oxygen, and sometimes even stopping some medications on their own. Long-term management. After the first month, patients are encouraged to manage their condition with their own pulmonologist, especially regarding medication management, drug interactions, and the need for oxygen, BiPAP or CPAP. It is recommended they follow up with a specialist or professor. Clinic experience. Our clinic has performed interventions on nearly 50 patients now. To reach this number, we evaluated 250 to 300 patients, finding that 20-25% were suitable for COPD balloon treatment, and these patients benefited from the procedure. When to seek consultation. We advise individuals to contact us if they have similar complaints such as lack of success with medications, decreasing breathing capacity, increased frequency of secretion and inflammation, attacks in the lungs, more than 2 intensive care unit admissions in the last year, and inability to climb stairs. And we would like to offer you assistance in determining the need for COPD balloon treatment, and we would be very happy to perform and to get you in this process and perform COPD balloon treatment for you, and we'd like to help your breathing. Please do not hesitate to contact us. We would be very happy to help you. Bye-bye.